Hey there, Dr. Susan Fox here at Health University. And today I wanted to go over, in honor of the Pregnancy and Infant Loss Awareness Month, some areas of concern that you may find yourself facing, and then some remedies that you might find yourself able to implement to help with recurrent pregnancy loss. I just read an article the other day that really touched my heart, in which the doctor was saying, there really is no such thing as miscarriage. A woman doesn't forget how to carry a baby. Something happens where, usually in this first trimester, chromosomal, abnormalities are showing up, and nature takes care of itself quite beautifully. So that is when an embryo will stop growing, stop producing its growth hormone, and then the messages will make their way back to allow for that embryo to pass. So it is not a miscarriage, it is a loss. And I really want to honor any woman and couple who has gone through such a loss, because it is really hard to fathom, and it's hard to understand unless you've been through it. That being said, there are some things that when a woman comes to me in private practice, having suffered recurrent pregnancy loss, I want to check some labs to make sure that there isn't a physiological reason why this might be happening. And those labs include a complete thyroid panel, especially if this is a secondary fertility issue, if she's already had a baby and is struggling with recurrent pregnancy loss, trying to have a second. We want to make sure that there aren't thyroid antibodies that have kind of begun to take play. And if so, there are remedies. There is a low dose thyroid medication that her doctor can offer. And then, of course, there are things that she would need to do in her diet and lifestyle to make sure that she is not triggering more inflammatory cascade activity. So a complete thyroid panel, including free T3, total T4, and thyroglobulin and thyroid peroxidase antibodies. The other lab that I want to always run is a vitamin D. And I know that there are those who might say, oh, just take 2000 IUs of vitamin D, and that's the standard dose, and you should be fine. And that might be true. But if your vitamin D is really through the floor, you may want to be taking 5,000, 10,000 IUs to really bump up that vitamin D level, and then titrate down to the 2,000 IUs and retest to make sure that levels are where they should be. The other thing that you might want to test are your iron, ferritin, and vitamin B12. B12, particularly if you're a vegetarian or vegan, because it's sometimes hard to get those vitamins through plant sources. Not impossible, but hard. So these are reasons why a woman's body may not be successfully holding a pregnancy. And so getting those values tested is helpful. Finally, a progesterone and estrogen level tested 7 days post-ovulation will let us know, is low progesterone a reason why a woman's endometrium is not able to hold long enough to allow for an implanting embryo to have that 2-week time frame within which to burrow on in. There are those who might say, if that is so, if your progesterone is low, then probably the egg from the follicle is not viable. And that may be so, but it may not be so. And so I come from the point of view of, why not give it a chance? There's no harm, and there's only potential help if progesterone is low, to just adding some progesterone, and that would be a prescription by your OB or your reproductive endocrinologist for that 2-week wait, starting 3 days post-ovulation in that following cycle, and then through either confirmed pregnancy, in which case you'll want to stay on that progesterone for a period of time under your medical doctor's guidance, or if there's not a pregnancy, you stop the progesterone and then you have your period. So that's physical, and yet that is just a small portion of what happens for a woman who's gone through recurrent pregnancy loss. I really also want to speak to the emotional well-being of this woman. And I'm going to speak to it through the 5 elements of Chinese medicine and the 5 emotional components assigned to the different elements of Chinese medicine, to say they might give us a clue as to how best to help rebalance this woman. So we have these 5 emotions that are assigned to the 5 elements, and they are as follows. If one's reflex to a recurrent pregnancy loss is to be angry, irritable, that tells us to look at her liver organ system. This is not just her organ as we understand it in the Western world. It is her liver organ system that includes not only her filtering device, but also her ability to, sort of produce hormones, to create, to sort of run through her life with the right amount of what we refer to as qi, life force. If her response to this recurrent pregnancy loss is one in which she's like, everything's fine, we're just going to try again next time, and really it's all unicorn and daisies here, quite likely that there is a little bit of hiding behind that facade of everything's fine and uplifted feelings and just look on the positive side, then she's not able to tap into some of the feelings of her heart spirit. So I would look to see how could we help regulate and balance that. If her thought is like she just can't get off her Google searches, she's worried, there's sort of this almost dog with a bone emotional component of I've just got to, study and research and discover and learn, and I just can't stop thinking about it. That directs us to the earth element, where our ability to sort of have integrity to our vessels, including our mind vessel, where things aren't leaking around and we're not trying to kind of patch up holes, if you will. This we can address with our earth element remedies through the pillars of nutrition, hydration, circulation, and restoration. If her response is that of deep grief, where she really is unable to let that go, we want to help work on her immune health, frankly, her lungs and large intestine that are our first barriers of immune health. The emotional component of that lung, large intestine system is grief. That is not how shall we say, sacredly processed, but it is kind of hanging on where she can't be in the present moment. And finally, if her response is one of fear, and by fear, I mean that dread of, will it ever happen? And do I even dare try again? That kind of fear, that kind of dread tells us that her kidney organ system, her water organ system is needing some help. And so once again, we will focus on the things that we can do to help reinforce and nourish that kidney water system. So if any of this resonates with you, my heart goes out to you. Please know that you're not alone. And then if you want to delve a little bit more deeply into, what might be your organ system, your 5 element, take the Your Fertility quiz. It's in the link below under yourfertilityquiz.com, and it will generate an in-depth report for you that will help you identify which organ system is better served by paying attention to getting it back into balance for you. And in the meanwhile, be gentle with your heart. You're not alone.